Good morning, Total Knee Replacement Support Group YouTube channel. My name is Tony Maritato. I'm a licensed physical therapist, and I want to answer a question that came from our Facebook group from an individual who had been working past 6 months following a total knee replacement. She wanted to know what she should be doing from an exercise perspective at this time. Now, whether we're talking 6 months, 12 months, 24 months, I would tell you that it's less important what it is that you're doing. It's more important that you're doing something. That's the bottom line. So if I take a step back and I go to the time of surgery, let's say that we have surgery January 1st. For the first 10 days, my primary focus as a physical therapist is to help to ensure the incision is healing well, there's no signs of infection, and the patient is getting as much rest and recovery as they need. Yes, we want to monitor the progress of range of motion, but it's not something that I'm going to be focused on or pushing really aggressively during the first 10 days of rehab, because the main priority is to recover from the trauma of surgery more than anything else. We want to make sure the bathroom habits are working normally. We want to try to optimize sleep if at all possible. And we want to reduce the stress, the emotional, the physical, the psychological stress on the patient so that they can really just put all of their energy into the healing process. Then I would say from day 11 to somewhere around the 4-week mark, we're going to be more focused on range of motion. We're going to make sure that we're focused on compression to reduce swelling if swelling is becoming an issue. We want to make sure that the incision continues to heal properly, that there's no sign of infection or drainage or seepage of any kind. We want to not just focus on the mobility and the strength of the knee itself, but we want to think about the rest of the body. The rest of the body should not suffer simply because the knee is not optimal just yet. So from days 11 to 4 weeks, we want to do things for the rest of the body. We could do arm exercises. We could do exercises for the other hip and ankle or the other knee. We could do yoga. We could do meditation. We can include mindfulness. We want to focus on nutrition as part of the recovery process. We're always trying to get better sleep. Sleep is so fundamentally important to healing. But the point here is from that 11-day to 4-week mark, we don't have to stress out too much. Yes, we work on range of motion, but we're continuing to improve the overall health of the system being your body. From weeks 4, let's say through 6, we can start to regain our normal functional activities. Usually by this time, the individual will be walking without an assistive device. If they didn't get rid of it already, they're transitioning away from it. We want to increase just normal community activity. We want to get you comfortable seeing friends and family. You know, now is a great time, weeks 4, 5, and 6, to just start rebuilding those social connections. I find that a lot of patients tend to go into their cave during the early stages of recovery. So now we want to get socialized again and come on back out into the community. From weeks 7 through 12, it's all about function. We want to practice balance and coordination. We want to optimize normal walking as much as possible. We want to be able to get on and off a low couch, a commode, get in the car. Usually patients are driving somewhere around the 6-week mark or after. So weeks 7 through 12 are really about function. Now, at that point, by the 12-week mark, the 3-month mark, most of the clients that are coming to my clinic have completed physical therapy. I don't have an active role in their recovery anymore unless they choose to join some of our self-pay programs. But what I'm typically expecting from 3 months forward is a return to the stuff that you enjoy. For some people, that's gardening. For some people, that's crafting. For other people, that's returning to business, to work. There's always going to be something, and if there's not something you want to return to, we have a different priority in that case. We need to find something that you want to return to. Everybody needs a goal. Everybody needs a direction. And so not having one, I have found over my clinical experience, does sacrifice a person's outcome because they don't have something they're working toward. You know, a lot of patients have pets. Getting back to walking their dogs and playing with their Cats, if cats play. I don't know, I'm a dog guy. But you know, it's that kind of stuff that we want to focus on. From there, 6 months, 12 months, 24 months, it just continues to be life back to normal and better. This is where we want to look at maybe picking up new activities, picking up new hobbies. Maybe you found a passion for something that you didn't know about before surgery that you identified during your recovery, and now you want to get to it. I know a lot of people love Orange Theory. A lot of people get into CrossFit, even in their 60s, 70s, and 80s. A lot of people will get into hiking and outdoor activities. It doesn't matter what you're doing. Once you've passed that 12-month mark, it is up to you and hopefully a well-versed physical therapist to identify a long-term strategy, a long-term plan, identify things you want to be able to do, things that you're going to work toward. Maybe you want to travel. Maybe you want to go and visit the Grand Canyon or take the family to Disney, and you want to work toward those specific activities. If you're one of the 20 or so percent who continue to have long-term problems, who continue to have pain and swelling, limited range of motion, frustration, that is the person, that is the individual who needs to continue to work with a team, whether it be a personal trainer, a licensed massage therapist, a physical therapist, occupational therapist, a surgeon. Put your team together to help you get past those barriers. We know that 1 in 5 individuals are often not happy, not better off after their knee replacement. Those individuals need a more specific strategy moving forward. But for the majority of clients who have had a total knee replacement, I would tell you the first 12 weeks are probably the most highly structured, progressing from this to that to the other. But then 12 weeks forward, you're pretty much cut loose to really just regain control of your life, live the life that you want, remember the reason why you had the knee replacement, and then take advantage of the new opportunity you have moving forward. Guys, I hope this was helpful. If you want to see more videos, this thumbnail right here is what YouTube believes you might want to see next. Go ahead and check it out. Otherwise, I'll catch you on the channel for the next video.